Hello, and welcome to MedicalRadicast, your source for news and radical ideas about medicine and healthcare. To my more conservative listeners, some ideas will be radical because they diverge from mainstream medicine. To my more alternatively inclined listeners, some ideas will be radical because they merge with the mainstream. Either way, stay tuned, listen in, appreciate something known, and learn something new. I'm your host, Mitchell Cohn, Doctor of Osteopathic Medicine and Medical Radical. Here at Medical Radical, we seek to inform, entertain, and inspire you to take action to improve your life, your health, your community, the environment, the world we all share. Today's main medical topic, Rethinking Medicine, Science versus Practice versus Profit, or Medical Science versus Anecdotal Evidence versus Snake Oil. Your choice. Today's podcast is full of information, opinion, and features, including a special Independence Day radical rant, your right to sleep versus your neighbor's right to blow up stuff, Eye on the Environment, about International Dark Sky Parks for unencumbered observation of the night skies, new feature, Brain versus Pain. Today we'll talk about chest pain that's not a heart attack, and old-fashioned remedies that actually work. So, to start today's show, I'd like to talk about sleep. And yes, this is about Independence Day. Sleep is vital, but so are good neighbors. Annoying, inconsiderate people who keep doing fireworks when you want to sleep are not good neighbors. Some states, my native state of Michigan being one, actually have laws forbidding law enforcement from taking action against anyone disturbing the peace with fireworks for 24 hours before the holiday begins and for 24 hours after the holiday. Does that mean no sleep for 72 hours? It can if you have neighbors like mine. So, what I would like to say is, if you're going to shoot off fireworks, try to do it before, say, 10, 10:30, even 11, but don't keep doing it until 12 or 1 in the morning. Now, I realize there are some people who live further north than we do, and it doesn't get to be dark until 11 o'clock. Well, I'm sorry, folks, then maybe you want to go out into the middle of nowhere to shoot off your fireworks. Or maybe you shouldn't be investing in the loud neighborhood-shaking fireworks. So just a small note to those of you who really enjoy your fireworks, go see them somewhere and let the rest of us sleep. Our next little feature is Eye on the Environment. I want to talk about my experience this past weekend at the International Dark Sky Park near Mackinac City, Michigan. I guess the first thing that we should mention is, what are International Dark Sky Parks and why are they important? Well, for links on this information, you can see my blog, www.mitchellcohn, that's mitchellcohn.com/blog. What the International Dark Sky Association has to say is the following. Once a source of wonder and one half of the entire planet's natural environment, the star-filled nights of just a few years ago are vanishing in a yellow haze. Human-produced light pollution not only mars our view of the stars, poor lighting threatens astronomy, disrupts ecosystems, affects human circadian rhythms, and wastes energy. Now, the truth is, I have always enjoyed looking at the stars. Many years ago, when I was much younger, we had a cottage in mid-Michigan, and you could go outside, and it was a relatively uninhabited place, and you could see, in fact, that was the very first place I ever saw what the Milky Way actually was and how it got its name. A beautiful milky band across the middle of the sky. It was really, really amazing. But honestly, I've almost never seen it since then. Light pollution is making it next to impossible to see anything but the brightest stars. So we went to this place, which is about 5 hours from our home, and my wife and I set up to observe, meaning we got some chairs out and laid down on those chairs. They're the fold-out kind, and we looked up at the night sky, and it was beautiful. There were still some problems. You better pick your night sky viewing nights a little better. We had a beautiful, clear night, and unfortunately also had a half moon, which was incredibly bright. And there was a haze, which could have been from a lot of the fireworks which were going off, or it could be something natural because this particular dark sky park actually looks out onto Lake Michigan, and there's a lot of land around there. And there was a haze rising, and the moon just lit up the haze, making it really tough to see the night sky. Now, you did get a beautiful, gorgeous view of the dark night sky if you look straight up overhead. In fact, we saw one meteor and what we think were 3 satellites just zooming across the sky. But it really was not as dark as I had hoped. It turns out that they have grades that the International Dark Sky Association gives, and this one is listed as a silver star. There are some places that are gold star dark sky parks. And there are only, I think, about 14 dark sky parks in the entire world, and they have to meet certain criteria. But my recommendation is pick places to visit at the time when there's a really nifty night show going on. Now, you'll always see some meteors shooting across. It doesn't matter what night. You don't have to have an actual meteor shower, but I'd love to go back and plan to go back when there is a meteor shower, clear skies, and no moon. You can't always get that combination, but that is something worth trying because it is very, very beautiful. If you've never actually seen the Milky Way or been to a light pollution-free area to view the night sky, you would be surprised at the emotional effect it has on you to see this immense vastness that we don't see during the day. All we see is blue with our yellow sun or maybe some cloud cover. But if you want a really stirring emotional experience, I might recommend that you go to one of these dark sky parks. Moving on to our next feature, the new Brain versus Pain. The reason I call it Brain versus Pain is because pain is a somewhat elusive medical condition. Most doctors really don't have an idea of what pain is, and many patients don't have a way to describe their pain. We do provide them with ways to describe it, saying is it sharp, is it dull, numb pain, tingling pain, stabbing pain, burning pain, pins and needles. We go through all types of descriptors that the patients can use, and the patients can show us where it is in their body, but sometimes it's not even distinct where it is. It can be an all-over pain. It can be a pain of the entire abdomen or chest, and you need to use a well-honed medical brain to not only figure out where the pain is, but what the cause of the pain is and why the pain exists, and then how to fix the pain. As an osteopath, I do have an advantage over a number of other types of medical practitioners because I have the ability to look at the medical side, meaning if it's heart pain or lung pain or neurologic pain, muscular pain, etc., versus whether or not it's just bones that are malpositioned or a nerve being pinched by a vertebra that's rotated, etc. You'll see how that plays out in our first featurette here on Brain versus Pain, which is chest pain that is not a heart attack. The first thing that people think of when they think of chest pain is, oh my God, it's a heart attack. And that is probably the first thing that you should think of. And it's the first thing that a physician should think of and rule out before they move on to things that are not quite as serious. There are a couple of other things that you should think of as a physician, which would be, is it some kind of lung dysfunction as well as is it some kind of heart dysfunction? And those are the most immediate concerns. If someone comes in and says they have chest pain and it's radiating up into their neck or into their back or down their arm, the doctor is going to rule out heart attack. If they're good, they'll also listen to your lungs. They'll rule out any kind of lung disease. If it's sharp, they're going to worry about whether or not it is pleuritis, which is an inflammation or possibly an infection of the pleura, which are membranes around the lung. But let's say, for the sake of argument, that all of that has been ruled out. You're left with chest pain that is obviously not life-threatening, but can be more than a little bothersome. There was an interesting time I had terrible chest pain. I couldn't even breathe, and I was driving my car along, and I stopped at a stoplight. But all I could think about was, don't take a deep breath. It hurts too much. And I'm sitting there with my foot on the brake with a nice big Escalade in front of me. Well, at least I thought my foot was on the brake. And all of a sudden, this Escalade started backing up on me. And I said, oh man. And I hit the brake harder and ran right into the back of the Escalade. Because my foot had not been on the brake, it had in fact been on the accelerator. But not being able to breathe deeply and not being able to concentrate because of the intense chest pain that I was having made me really unfit for driving. Pain in general can do that to anybody. And of course, as a physician, I should have known better, but as a human being, we force ourselves to do things, even when we shouldn't. Well, this question regarding chest pain has come up numerous times on healthtap.com, where I'm one of the many physicians who provide answers, but I think I provide a unique perspective. I cannot tell you how many times in a day, in fact, this question would come up. Over a 1 month period, I answered it about 20 times and then I stopped answering. When people would say, "Dear doctor, I have chest pain in the front or in the back. It hurts when I breathe. What could it be?" The first thing I would need to know is, does it hurt both in the front and the back? Does it hurt more with a deep inhalation? Does it hurt more with a complete exhalation? Does it hurt when you push on the chest anywhere? Those tell me whether or not it's muscular and skeletal and whether or not it is a rib. Believe it or not, probably the most common source of chest pain is a rib that has stopped functioning very well. Ribs are supposed to come up in front when you inhale and go down when you exhale. But sometimes your rib gets stuck. So you go to inhale and most of your ribs go up except that one rib. And it can cause anything from a sharp pain to a dull pain. It can be in the front. It can go to the back. It can actually radiate around the side. And what's really amazing is that 99% of all doctors actually have no clue what's causing the chest pain. If it can't be measured by an EKG, can't be seen on an X-ray, and these things cannot be seen on an X-ray, but you can feel them with your hands. You can tell when a rib is moving or not moving. Without the ability to actually visualize it somehow, these folks have no idea what it is. But with your hands, a good manipulator, a chiropractor, an osteopathic physician, a napropath who's well trained can pull that rib or relax the muscles around it to get that rib to function again. And it gets rid of your pain virtually instantly. Sometimes if it's really stuck bone on bone, you can just pop it back into place. Funny enough, my wife, after having lived with me for so many years, has learned how to manipulate the ribs of her friends who say, "I've got this terrible pain," and they describe it to her and she says, "Aha, that's a rib." And she can help them put it into place. And yet if you go to any MD and many DOs who do not practice osteopathic manipulation, they will actually not be able to help you. So think about this the next time you have a chest pain that's severe, that won't go away. Ask yourself, does it hurt when I breathe, either very deeply in or exhale all the way out? Does it hurt when I push on that area of my chest? Because if it were heart, it would not hurt when you push on it. If it were lung, it could hurt, but probably wouldn't. If it does hurt when you push on it and meets all those other criteria, I would consider getting to someone who can manipulate it back into place and get rid of your pain, and that way you won't need OxyContin or Vicodin or all of the non-steroidal anti-inflammatories you can possibly take, none of which, by the way, get rid of that pain. But you can get rid of it if you go to the right doctor. Let's take a short break. And welcome back. We're going to move on to today's main medical topic: medical science versus anecdotal evidence versus someone trying to sell a product or idea to make money. And I don't think there are as many of those charlatans or snake oil salesmen as you think, but we'll talk more about that. You've often heard me rail against corporate medicine for their unscrupulous, profit-mad dash to extinguish real medical care in their efforts to make money. Their control of the FDA and its approval process, which I'm not going to go into at this moment. Control of access to medical care via insurance companies' regulations. Again, I'm not going to go into detail on this. I have before and I will again. I've talked about corporate medicine pushing medicines and procedures when non-medicinal approaches or less invasive, less profitable, more sensible approaches will do. They're pushing overuse of even good medications for profit at the expense of consumer health, including direct-to-consumer marketing to get patients to demand medications doctors wouldn't otherwise think to prescribe. Pushing ever newer medications even when older medications have safer track records, fewer side effects, and essentially the same efficacy. Well, think aspirin, and then they pushed ibuprofen, and then they pushed Vioxx. which of course ended up being taken off the market because it had a few more problems than aspirin, such as it was killing people with heart attacks. Or corporate medicines eschewing natural remedies because they can't profit from them, and leading physicians and medical institutions by the nose away from these natural remedies. And we'll look at one example in our old-fashioned remedies that actually work feature in a little bit. But what about the opposite end of the spectrum, the, quote, snake oil salesman, unquote? We haven't talked about them. Part of the reason is they don't have the large impact of large corporations. They may still sell millions of dollars worth of merchandise to the unsuspecting and overly hopeful, but how do we separate the truth from the lies in their claims? Let's talk about what constitutes proof versus sales ploys. Is it exaggeration or is it outright lying that they're doing? Most of the time, believe it or not, it's not outright lying. We'll talk about that a little further in a second. Is it based on science, solid individual experience, coincidence, or fabrication? Well, there are a couple of ways to try to figure that out, which we'll talk about shortly. But first, I want to talk about what we mean when we say science or scientific experimentation or studies. The ones which are most often accepted, in fact, the only ones which are really accepted for the most part, are randomized controlled trials, which essentially means prospective studies where you take patients, divide them up into certain groups, and perform an experiment on them, either giving them a real medicine or a placebo, or giving them one set of medications versus another set of medications, and comparing the results. The true gold standard is what they call the randomized controlled double-blind study, but some things are not amenable to double-blind studies. Medications, yes. Double-blind means that neither the patient nor the doctor knows what the patient is getting until the labels are revealed. We won't go into how that's done, but suffice it to say that by blinding the doctors as well as the patients, there can be no bias in figuring out the results of the study. But some things are not amenable to that, such as osteopathic manipulation or chiropractic. Anything that involves hands-on, the doctor cannot be blinded. They know whether they are, in fact, performing a procedure that is supposed to help the patient or whether they are doing something that is actually not supposed to help the patient. That, unfortunately, can lead to bias in the studies. But this is the part where I have some questions. What about observational evidence? What do I mean by observational evidence? I mean what we can call either retrospective studies or simply what we see with our own eyes on a daily basis. For the purposes of medical science, it's important how the information is collected. In other words, there have to be some kind of specific measures and very specific outcomes, and you have to ask specific questions. For example, you may look back over 1,000 patients who were given a specific medication, let's say Vioxx, and say, did they improve in terms of their pain? Yes, they did. But it was observed that a good percentage of them also had heart attacks. It was actually this observational evidence observing, no one was inducing these heart attacks on purpose, so it was not exactly a randomized controlled trial, but it was the observational evidence that people were developing heart attacks at a given rate, and that rate was higher than if the patients were not given Vioxx. That's an observational study. Now the question is, how large do the numbers of observations have to be acceptable to medical science? That's a question I honestly cannot answer. And the reason is, I do prolotherapy, which is an injection therapy, also called regenerative injection therapy, which is used to strengthen ligaments and tendons and help get rid of pain. There is a wonderful position paper which was endorsed by the Florida Academy of Pain Medicine in 2002, which examines over 500,000 cases, 530,000 cases, but they were not done as part of a randomized controlled trial or anything like that. They were cases performed by many physicians and reported over a 100-year period since prolotherapy was first used on humans, and it showed it to be between 50 and 80% effective at partially or completely resolving various pain syndromes, but they had fewer than 60 significant complications. Well, okay, that's probably a crazy underestimate. Even in the best hands, if you're poking needles in around the ribs, for instance, you're going to puncture a lung every now and then. But we're talking more than 500,000 cases that showed this particular procedure, which was a very simple procedure, which involved only utilizing glucose and water to fix people, which means there was no significant profit for drug companies because there wasn't a drug used. Glucose is simply sugar. You can find it virtually everywhere in nature. It's in our bodies. It's what feeds our brains. And now, just in the last couple of years, prolotherapy is endorsed even by the Mayo Clinic. It's not that I think that much of the Mayo Clinic, but the rest of American medical institutions seem to think the world of it. But despite its endorsement by the Mayo Clinic and the fact that there was what was called a meta-analysis, which involved more than 530,000 cases reported, Medicare, which is essentially the medical arm of the government, still calls it, quote, experimental, unquote, and they refuse to pay for it. But even though there are something like 3,000 studies that show injecting steroids to be harmful to joints, ligaments, and tendons, eventually exacerbating the original problem for which the steroids were given and having severe side effects to boot, these steroids are considered effective treatments and they are paid for. That would be because many of those studies were randomized controlled trials. Or what about the injections into knees of padding liquids like Synvisc, which have no healing potential and which provide only temporary improvement of pain? These are paid for because they were studied with randomized controlled trials which showed that they were effective to some extent, meaning they helped people have temporary relief from their pain and they did not have significant side effects. But these are paid for, even though the injection solution costs around $1,200, and that's not including the doctor's fees. But Medicare will pay for these because they have randomized controlled trials showing that they are not injurious to the patient, even though they're not specifically effective or really help the patient's knees get better. What they do is they help the patient last a little longer until the knee is ground down so far that they have to have knee replacement surgery, which of course makes the surgeons happy. So, randomized controlled trials, even though the benefit of whatever procedure or substance is being studied is minimal, and the risk may be great, as long as there is a randomized controlled trial, that far outweighs observational evidence, even though the observational evidence shows the risk to be minimal and the benefits much greater. In other words, prolotherapy is not something that is readily paid for because no drug company is going to fund a randomized controlled trial or a double-blind study because they have no way to make money off of it. Now, that does not mean they're not trying to do some of these studies now, but they're done on a much smaller scale that is less acceptable to the Food and Drug Administration, the FDA. So when is the unproven acceptable to try? Does a condition have to be life-threatening with no hope of recovery? Does there have to be no surgical alternative? Does there have to be no AMA-endorsed, FDA-approved device or medication for the condition? Must there be a proven or even, quote, acceptably scientific, unquote, explanation for how it works? Well, let's examine that. There's no acceptably scientific explanation of how acupuncture works, but even the National Institutes of Health finds that it does work. And what about the concept that every person is different? Some things work for one person and not for another. For example, it's well documented that red-haired people respond more poorly to anesthesia. Yes, if you've never had this experience, it's true. My son and friend are both redheads and both respond very poorly to anesthesia. My friend, when she's had to undergo surgery on 3 separate occasions, they had to double the dose for her of anesthetic because she had a tendency to wake up. Then they found a gene located near the red hair gene that seems to control the way a person responds to anesthetics. Now that makes it an acceptably scientific explanation. So now we can say, okay, that concept that the red-haired person may respond more poorly to anesthesia, so we have to give them more anesthetic, is accepted by the scientific community. Before this, it was anybody's guess as to whether or not it was okay to give someone more anesthesia if they had red hair than if they had some other color of hair. And we'll talk more about that in a little bit. There's also the question of, is there suppression of evidence? Now, I don't consider myself a conspiracy theorist, but there is evidence mounting that convinces me that Big Pharma has had a direct hand in controlling FDA approval of medicines. The FDA has taken steps to reduce the conflicts of interest, but I still think that Big Pharma has a significant input into pushing drugs for approval, and I think that's borne out by the large number of medications which had been approved by the FDA over the last few years that had to be recalled because they were found to be unsafe, but only after they had been administered to tens of thousands or hundreds of thousands of people. And let's look at the history of medical marijuana. Has there been suppression of information? Yes, there absolutely has. Probably most people are not aware that marijuana was endorsed by the AMA, the American Medical Association, since the 1850s for about 90 years as an acceptable and useful medication. But once drug companies began to develop other medications from which they could make a significant profit, they didn't simply say, okay, marijuana is a medication that can be used, but it may or may not be the best for condition X. Instead, they said, under pressure from the pharmaceutical companies, no, marijuana has no place in medicine. It can no longer be used. This change was forced in the mid-1940s when marijuana was finally removed from the National Pharmacopoeia, which is a list of drugs that have acceptable medical uses. And why do you think that there was no significant research that went into finding out whether or not marijuana was in fact safe and medically useful for many, many years? That's because pharmaceutical companies couldn't make a significant profit off of it. People could grow it in their backyards. And the pharmaceutical companies did not like that. So this information was suppressed. And over many years, the majority of doctors were taught that marijuana has no medicinal value. And that's simply not true. It does, in fact, have significant value. I talked in a previous podcast about its incredible efficacy for seizures in some people, much more effective than the pharmaceutical medications. But that information overall was suppressed. With the ever-increasing influence of big money on everything from instructing us what to buy to political ads telling us what to think, I am suspicious that some heavy-handed manipulation of the American medical psyche has taken place and will continue for the foreseeable future. Does any of this excuse the millions of dollars people make selling snake oil? Now, my problem is this. How much of the information that these people who sell the snake oil is outright lie motivated by pure profit, and how much is based on an observation someone made, perhaps on a single individual, perhaps on several, whose health improved coincident with the administration of the remedy? The example would be the common cold. The cold usually lasts 1 to 2 weeks. If you give someone a medicine at 6 days and by day 7 they're better, then suddenly someone is selling a cure for the common cold because they believe that the person got better because they were given the medication, rather than the virus just ran its course. Does that make an outright lie? No, it doesn't. Is it an exaggeration? Not in the mind of the person who is selling it. So I don't consider that snake oil. It's a remedy that may or may not have significant value because of a very small number of observations. This is where the scientific method steps in, trying to control the conditions under which the remedy is administered and trying to figure out whether the beneficial effect of the remedy is consistent over time and across many people, and whether or not there are any significant side effects. But here's where we have to take in individual variation as a consideration. I talked about anesthetics. If most of your test population is redheads, you'll show that anesthetics aren't very good. When you then ramp up the dose and give it to non-redheads, that's lethal for those non-redheads. The scientific method tries to control for this by using a broader slice of humanity, including people of all nationalities and hair colors, and eventually, and this is the key word, eventually, science figures out why some people respond better at lower doses and others are resistant to lower doses. What about, though, when there's no visible marker like red hair? An example might be sulfa antibiotics, which work great in many people. But then someone dies, and we don't know why they died. They were sensitive to it. They had an allergy to it. Their kidneys stopped up. 40 or 50 years later, we learn that people with certain conditions, dehydration or systemic lupus erythematosus, they almost always do poorly. They have complications from using the sulfa antibiotics, but we still don't know why other people react badly to it. But what about the people that benefited from it? What about the lives saved in World War II by the administration of sulfa drugs in the pre-penicillin era? Was it wrong to administer the sulfa drugs? We didn't know a great deal about it. We didn't know why some people react badly and some people don't, but observation showed that it did work in many people. So I submit that the test of many supposedly snake oil remedies is in the power of number of observations, whether done under scientifically acceptable conditions or not. The example is prolotherapy. You got 500,000 plus documented cases showing that it's effective. I consider that pretty good evidence, whether it's written in a medical journal or not, and whether Medicare calls it experimental or not. I'm now employing something very vaguely related to prolotherapy, named by its discoverer neuroprolotherapy, which I think is a total misnomer. But prolotherapy is using between 10 and 20% concentration of glucose in water to cause inflammation. It's injected directly into the ligaments and tendons in order to cause proliferation of connective tissue, to tighten down those ligaments and tendons, which takes strain off them and reduces the pain produced at those joints. Neuroprolotherapy, although it uses glucose, uses only 5% glucose, which is physiologically normal glucose. That's what you'll find in our blood. It does not cause inflammation. In fact, it calms down inflammation. Now, there is not a significant body of evidence about this right now. There are people who are trying to do studies, but they cost a lot of money. No drug company is going to back this. Will they ever see it published in a scientific medical journal? I don't know. I will give them credit for trying very hard. But as a physician who deals with people in pain, I will look for anything reasonable that has few or no side effects or risks for my patients, and I'm willing to try it. So I tried this neuroprolotherapy for free because it's unlikely to be harmful, and if its discoverer, John Liftoft, that's Lyftogt, is correct, it holds great potential for helping people with pain. So after doing about 10, 11 patients with it in a row, my experiences were amazing. I could not believe how many people had instantaneous relief of their pain. My personal observation is important to me, and I observe that these patients are in fact improving. So should I or should I not use this? It's not particularly harmful, and it seems in my practice, in my hands, to be extremely helpful to these patients. I had a patient just the other day who could barely get out of a chair for 2 years because it hurt so badly for them to do that. I did these injections, and within minutes, the person had no pain at all. But this is just observational evidence. Should I therefore not use it? Is it snake oil? Believe it or not, some people will say, absolutely. Until the randomized controlled trial studies come out, until the double-blinded studies come out, they will say it is snake oil. Except the studies won't come out, or they won't be acceptable because there's no profit for pharmaceutical companies in it. So it falls to people to find private funding from other sources, from more altruistic sources, to get these tests done. And that could take far, far longer to do the studies in sufficient numbers to be acceptable to medical science, as proven by prolotherapy. Still not acceptable to medical science as a whole. It still doesn't see approval by Medicare. The studies have overall not been published in medical journals because the studies don't have enough subjects and they lack the power to be so statistically significant that the medical community is forced to accept the validity of the treatment. I see that happening for neuroprolotherapy as well. So I suspect insurance companies will also not pay for neuroprolotherapy for many years to come, which keeps one more thing off their books that they need to pay for. And just as an aside, I often wonder what the financial relationship actually is between insurance companies and big pharma anyway. If anyone knows, let me know. Anyway, the point is, I think there are fewer snake oil salesmen out there than medical scientists and big pharma would like us to believe, but caution must be exerted by you, the consumer. Acai seems to work for millions in helping them lose weight, so it remains on the market. Not many studies prove its effects, but it works for some people, enough to keep the market alive. It's not prescribed by physicians. It doesn't work for me. In fact, it makes me ravenously hungry. Now, I actually couldn't believe that, so I tried it a couple of times, but it makes me ravenously hungry. It's supposed to cut your appetite. I obviously have the wrong genetics for it to be effective. That doesn't mean it's snake oil. It does mean try it at your own risk. Caveat emptor. Let the buyer beware. I also want to relate an experience with something called Fat Trapper. About 15 years ago, I would say, my daughter and I, who were both overweight, decided we'd had enough. Dieting didn't work for us. Exercising didn't work for us. So we decided to try something that we saw on television called Fat Trapper. It was a proprietary blend of substances, including chitin, which is actually made from the crushed up shells of crustaceans. Amazingly, this stuff worked wonderfully. You had to take it 20 minutes before you were ready to eat, but it cut our appetite so much. I lost 11 pounds in a week, and I literally could not eat a small child's serving for dinner. My daughter lost, I believe, 7 pounds in that week, and she had the same thing where she was not hungry. It worked wonderfully. But then they changed the formula because they wanted to make it work faster, meaning you could take it right when you ate. And it failed miserably. All of a sudden, it didn't work at all. Medical science, in other words, the FDA, claimed Fat Trapper never worked, that none of its claims were ever true, not whether it was the slower working version or the faster working version. I believe they forced the company to withdraw it from the market, and the company went bankrupt. But the fact is, at least in its original version, it worked. It worked for 2 of us out of 2 people. That's our observational evidence. Was it worth a try? It was for us. Unfortunately, the FDA did not agree, and neither version was left on the market. However, you can find just chitin at any health food store. Unfortunately, it does not have whatever the other proprietary ingredients were that cut appetite. But nothing tried, nothing gained. Just don't necessarily be the first one in your country to try it. Where do you find out what others know about a particular substance? Oh my God, here's another problem. Can information provided on the internet be trusted? I say yes, with application of common sense. Look at scholarly articles if they exist. Look at medical journals. Look at what individuals who have experienced it say, and never use just a single source of information to form your opinion. Don't look at one article or one person who says, this is terrible, or, oh, this is amazing. Do your research and use your common sense to evaluate fact from fiction. Talk to friends. See if they've tried it. Talk directly to people who have experience with the treatment of the product online. Believe it or not, there are a lot of other human beings out there. Yes, some of them are probably shills for a particular product, but there are a great many human beings out there who actually will take the time to answer your questions if you put them out there on chat boards or Facebook or wherever. Also, I suggest that you be aware of whether the person telling you about the remedy has something to gain. For example, I've often wondered whether Dr. Oz first buys a large stake in a company, say one selling green coffee beans or forbidden rice, right before he endorses them. Now, people believe him because A, he's a real doctor, B, Oprah likes him and she's a celebrity, and C, he's now a celebrity in his own right. So that makes him believable. But is he endorsing something because it truly works, because he has seen it work, or because he has evaluated whatever scientific or study information is out there? Or is he endorsing it because he bought a stake in the company? Or is it all of the above? It's easier to trust the opinion of someone who has nothing to gain, don't you think? Well, my advice is the following. Don't dismiss something because medical science hasn't caught up with what has been regularly observed. But before you yourself try it, see what a few thousand other more adventurous and less safety-conscious souls have found out first. And there will always be the brave and the foolhardy who use things as soon as they hear of them. It's part of the statistics of human nature. If, however, you see people, the same people, over and over again, are willing to put their money into something, it's a good bet they find benefit from it. Then it might be worthwhile trying. I hate to sound unscientific because I am a scientist at heart, but there are so many things in medicine, many of which I use on a regular basis, like I already talked about, prolotherapy, osteopathic manipulation, with which science has not yet caught up, but which are, in my hands and for my patients, highly effective. If you're on the cutting edge and you fail, you're a charlatan and a snake oil salesman by definition. If you succeed, however, you're a leader and an innovator. Without innovation and people attempting to improve their lives and the lives of others, we would all still be using sticks and stones and may not even eat cooked meat because, after all, fire burns. Let's take a short break. I'd like to take a moment to talk about a couple of books I've written, which I think are very important. They provide insights into what it means to be a physician and provide some challenges which give you, the reader, an opportunity to make some serious medical decisions, a chance to play doctor without getting into trouble. The books are in the Osteopathy and the Zombie Apocalypse series. The The first book is for the layperson. It gives you the opportunity to become the doctor and compare chiropractic philosophy and therapy with that of MDs and with osteopathic philosophies and treatments. You're faced with scenarios from a zombie-infested world as the creatures wreak havoc on life and health. In each case, you are the doctor, and you make the decisions which could lead to healing, to injury, to life, or death. By the end of the book, you will understand the differences between MDs and DOs, as well as between DOs and chiropractors very clearly. It will help you decide what kind of physician you would like to have help you if you are in need of medical advice or treatment. The other book in the series is actually a career guide for pre-med students. If you're interested in becoming a doctor of any kind, this book could well help you make the choice of what kind of doctor you want to be. Both are fun reads and are highly acclaimed on Amazon.com with almost universal 5-star ratings. You can check the books out on Amazon.com or directly on my website, www.mitchellcohn.com. Go ahead, have some fun playing doctors and zombies and see who wins. Your feedback, either directly to me on my website or via email or telephone, or better yet, by rating the books on Amazon.com, are always welcome. Electronic editions for Kindle and paperback editions are available. Go ahead, read, and feed your brains. On to our final segment, old-fashioned remedies that actually work. Today we're going to talk about milkweed. That sounds exciting, doesn't it? Milkweed. Well, there are a lot of varieties of milkweed. Common milkweed is a perennial plant. Breaking the stem reveals a thick, milky substance, essentially a latex. It's very similar in consistency to latex paint. All of the milkweed family have that similar sap. Locations in the eastern United States and Canada, but as far west as Kansas and Saskatchewan. Articles claim it's been used by Native Americans for numerous problems, from kidney problems to asthma, gallstones, and arthritis. It's been used as a laxative and to cause temporary sterility. I'm not going to endorse its internal use, however. In large enough quantities, it's also apparently kind of poisonous. Small amounts, not poisonous. Large amounts, pretty poisonous. So, I'm only going to endorse it for the moment for the treatment of warts because of my personal experience. When I was growing up, if I had a wart, Mom used to take me out to the backyard, break open a piece of the plant, and put that milky sap on the wart. 1 or 2 treatments, and the wart painlessly disappeared. Compare this to the current treatment for warts. Everything from repeatedly putting acid on your skin to burn away the warts, which you may have to do for weeks at a time, or freezing the warts with liquid nitrogen, which I've had done and is quite painful, or even injecting Candida yeast antigen under a wart to get your body to immunologically react to the wart to get rid of it. I'm sure Dr. Scholl's and all the other wart removal companies would prefer you don't use milkweed to treat your warts. But they'll still stay in business. It's kind of difficult to find milkweed in the winter anyway. But one more benefit of milkweed, and this is non-medicinal. It is the exclusive food for larval monarch butterflies. Having milkweed growing nearby is likely to provide habitat to butterflies and bees and other nectar-seeking insects. Since leaving the house that I grew up in, I do miss having my milkweed handy. I'm planning on planting some this year so I can have it. I want you to know your feedback, comments, concerns, and even personal stories are welcome. You can either write to me, Dr. Mitchell Cohn, at MedicalRadicast at MedicalRadical.com, or you can call and leave your feedback, comment, or story as a voice message on our Skype line at 734-931-MRAD. That's 734-931-6723. Your voice may even make it into a future podcast. Thanks for listening to Medical Radicast. I hope you've learned something you didn't know before, been entertained along the way, and will now maybe even take action to improve your health or healthcare, whether doing a little research, looking for a new doctor, or even just being willing to ask more questions to the people you've trusted with your healthcare for so long. Your health is in your hands, and that, my friends, is a radical idea. It's been my pleasure to be your host on the Medical Radicast. I look forward to speaking with you next time. This is Mitchell Cohn, D.O., the Medical Radical.